Greetings, my name is Professor Ann Beatrice Kihara. I'm really happy to be here in Makueni County in Wote, in the Mother and Child Initiative. We have what we call Okoa Mama na Mtoto Initiative, which really looks at surviving mothers and babies. But my question has always been, where are the men? And we decided to actually start a social innovation that looks at the Bodaboda, men in maternity care. We have spent time together with the senior management of health in Makueni County, and very pleased to report that even His Excellency was part of the deliberations to start men in maternity care in Makueni County. We've had the first training, and you can see I have my colleague Bodaboda men who are here with us, trained in the continuum of care, not just having pockets in which men can engage, but to have them engaged right from before pregnancy, at the beginning of pregnancy, during that pregnancy, at delivery, and in the postpartum period follow-up. We've even gone a step further, knowing that we have a very high teenage pregnancy rate, to actually look at social empowerment of the girl child. We recognize only 20% of any maternity care engages the men. So through this continuum of care, we are hoping that we will be able to achieve better survival of mothers, better survival of babies, and better survival of young girls, so that they may continue to be in school and to have planned married life pregnancies. We have had representation from the leadership in Makueni County in total, right from the chairperson to the sub-counties and to the wards. And we are hoping that with this group of master trainers, they will be able to percolate the information to the last mile. We also take note, why the Bodaboda? More often than not, women who are expectant or women who are carrying their babies back home tend to use this as the means of transport. Makueni is full of a lot of hills and valleys, and oftenly even an ambulance in emergency cases cannot reach the woman. But with this bridging of having Bodabodas with us, the community health promoters with us, and then the health facility to assist us, we are hoping many more people can access maternity. We have a slogan, 90, 90, 80, 80, 80. 90% of the mothers should have at least 4 antenatal visits. And we're asking the men to join us, at least in 1. 90% of our women should be delivered under skilled birth attendants. And we want the men to be with us and to engage with us, because we recognize a lot of complications do happen at the time of delivery. And when they're distant, we're not able to reach them. But with them getting closer to us, we're able to reach them. We still know a lot of our primary cause of maternal death as postpartum bleeding. Bleeding after childbirth. We don't want to have ad hoc requests to the men. We want them to be with us and engaging with us. So when we even ask for blood, we have a cohort of men we can call upon with complications. When newborns are born, whether in the hospital or at the home, and they complicate, we want them to be able to recognize in the villages and bring them to the hospital. Postpartum follow-up, we are saying all women must be seen within 48 hours of delivery, whether it's a delivery that happens in the hospital or a delivery that happens at home. We have definitely taught them what are the danger signs for the mother and what are the danger signs for the baby. As if that's not enough, we have even advanced the conversation to make sure that they are engaged in the upbringing of their children, so that they know breastfeeding has to happen exclusively for 6 months. Family planning is part of development and not just a woman's issue. Nutrition is a critical pillar in all these continuum of care. And last but not least is to really recognize that the girl child must be empowered from a very tender early age so that we can now begin to have them more in school, having less of teenage pregnancies, having their life skill and ability to say no to premarital sex or premature sex. And to even recognize education does not mean formal education. Even going for technical and vocational jobs would make a difference. We are hoping with male engagement, and particularly the men in maternity care, as we walk with them and get more and more enlightened with them as to what needs to be done in this local community, we will definitely have better survival, better thriving, and a transformed community where we have positive masculinity as part of the maternity care. Okoa mama, okoa mtoto, lakini bila baba hakuna kuwaokoa zaidi. Baba lazima awapo. Asante.